Hello, welcome to our Health for All website tutorial. What is Health for All, or HFA? Our Health for All website is the central location for information about health and factors that impact health in our community. It contains local data, promising practices, and new articles. It also serves as an opportunity for community members, partners, researchers, students, or anyone who is looking to gather local health data. The Health for All website serves as the primary home to Washtenaw County's Community Health Improvement Plan, also known as the CHIP. The CHIP is roughly a 5-year cycle, which begins with planning, a community health assessment, a prioritization phase, a CHIP development phase, and then an action phase. Right now, we are in the action phase, which lasts about 3 years. On the website, you will find the data, stories, and actions of the Community Health Improvement Plan process. Now, let's take a tour of the Health for All website and learn how to properly navigate it. Once you're on the home page, you'll find 4 tabs: Explore Data, Resources, Get Involved, and Site Info. Also on the home page, you'll see a search bar, data, stories, and action highlights, and you'll get a glimpse of data snapshots. We will take the time to explore all 4 tabs, beginning with the Explore Data tab. Here you will find our Community Health Assessment and Improvement Plan, all indicators by location, community dashboards, our Build Your Own Dashboard tool, and more county data, which could include Washtenaw County Health Department reports. When viewing our Community Health Assessment, you'll find continually updated information, including our prioritized health needs. Our prioritized health areas are mental health, healthcare access and navigation, access to healthy food, and any supporting information that goes along with them. Lastly, you'll find additional CHA and data materials. This includes demographics, methodology, and disparities. Next, we'll navigate to the Resources tab. Here you will find all of our Health for All stories, funding opportunities, promising practices, our report creator, and local resources. Next, we'll navigate to the Get Involved tab. Here you're able to sign up for updates using your email address, first and last name, along with your zip code. Lastly, we'll take a look at our Site Information tab. Here you will find this informational tutorial, our About Us page, and frequently asked questions. Now, let's dive into how and where to find the information that you're looking for. But first, we must make a note about data limitations. Most of the data on our Health for All website comes from sources outside of the health department. We are not the owners. Therefore, zip code or census tract level data, as well as any additional demographic information, may not be provided if it is not available in the source dataset. Additionally, it takes time for valid and reliable data to become available. Therefore, the most recent data available and displayed for certain sources on the Health for All website may be around 2 to 4 years old. Now that we got that out the way, let's look at what is an indicator. An indicator is a piece of information that describes an aspect of a population used to measure health or quality of life. There are multiple methods for searching for an indicator. First, you'll simply enter keywords into the search bar in the middle of the front page. Next, you can search all indicators by location by clicking on the Explore Data tab and selecting All Indicators by Location. Once you're in the Explore Data section, one of the easiest ways to find information is by using the All Indicators by Location page. Here you will see a large list of indicators grouped by category. When you click on any indicator, the site will ask you to choose a location you want to view. For example, you'll select the county, a city, or a specific zip code. This step makes sure you're seeing the data that's most relevant to your community or the area you're researching. After you choose your indicator and your location, the site takes you to a detailed indicator page. This is where you'll find the full dashboard for that indicator, including the main data value, trends over time, comparisons, and any available demographic breakdowns. Think of this page as the final result of your selection. All the data and the context you need is clearly laid out in one space. When viewing an indicator, there are several components that come along with the page. There you will find the title, location and measurement periods, which can both be changed, background information, why the indicator is important, targets and comparisons, data, data sources, and any related content. Let's walk through each component. First, we'll begin with title. This is the name of the indicator or what information is being displayed. Location is where the data is being shown for. The measurement period is the time period in which comparisons and additional demographic information are being displayed. You can click on the location or the measurement period to change it with a drop-down box. Next, you'll find background information, which gives you more detail about the information being shared within the indicator. And you'll also see why it is important, any additional context used to describe the importance of the indicator. Another unique component is the targets and comparison section. You're able to see comparisons for local measures to other locations and prior values. Additional information on understanding or interpreting these targets and comparisons are available in the frequently asked questions section, as well as the legend, which you can click Show Legend to see. When looking at an indicator's legend, you'll first start off by looking at colors. Red means the value is worse or bad, green means the value is better or good, and blue means that the value is not statistically different or basically neutral. So think about it as red means area for concern, green means we're doing well, and blue means no meaningful difference. Next, you'll compare the distribution. You might see little arrows or icons indicating how the selected area compares to other communities. These tell you what quartile the values fall into. So it's basically showing you whether the area is performing high or low compared to everyone else. Next, there's a comparison to the target. Here you'll see whether or not the indicator meets the desired target. A green check means that the target is met. A red symbol means that it does not meet the target. Next, you'll see a comparison to a singular value. Sometimes data is only compared to one specific value. Icons here can show you if the value is lower than the comparison, higher than the comparison, or not statistically different. Trend over time. The trend icons will explain whether the value is changing over time. A green upward arrow means significant positive change. Upward arrow means a significant negative change. And a straight line means no change over time. So you can quickly see whether things are improving, worsening, or staying the same. Next, you'll compare it to a prior value. These icons focus specifically on whether the newest measurement is better or worse than the previous one, higher than the last period, lower than the last period, or not statistically different from the last time. And finally, you'll see the overall value. At the bottom, you'll see simple labels, better than the overall value, worse than the overall value, or similar to the overall value. Or, again, no confidence interval available. So in short, the legend is your quick guide. It tells you how good a value is, how it compares, whether it meets goals, and how it's changing over time, all without needing to dig into the details. Additionally, while viewing an indicator, there are data and charts presented. The top left corner shows the location-specific value for the measurement period selected at the top. Scroll to the bottom of the indicator page to see the source, when it was updated, or any additional information. A main chart is produced for each indicator showing the data over time for the time periods available. Now we'll scroll back up and look at the top left corner of the page. Here you'll find the data source. This is the link to where the information is coming from. And you'll find the related content. This contains any extra content relevant to the information within the specific indicator, other linked related indicators, links to featured pages of related community work, and relevant promising practices and funding opportunities. Next, if you decide you want to export information from indicators, you're able to export all data by downloading available CSV files. Let's take a look at an example. Infant mortality rate. Here, we are able to see the value from the time period of 2021 to 2023. Next, we're able to see the infant mortality rate compared to the state rate. We can also see that this indicator is improving over time, but it does not meet our target value. Lastly, we can see a breakdown by race, indicated by different colors. Let's look at another example. Adults with diabetes. By pressing the play button at the top, you're able to look at a timeline of this particular indicator. Here you can hover over specific locations for more details. You're able to view all zip codes simultaneously or select a specific area. Now that we're having some fun and we understand how to view indicators, let's start thinking about dashboards on our Health for All website. Here you will find pre-built dashboards, and I'll also show you how to make your own. Community dashboards. A way to view various indicators related to a particular topic or population simultaneously. You can access through the Explore Data tab on the main page. The dashboard displays the most recent data value, any associated comparisons, and demographic breakdowns if it is available for a relevant indicator. You can then click into individual indicators from the main dashboard page. Within community dashboards, there is a demographics dashboard. This shows county demographics. You can also see all data for specific locations, a disparities dashboard, population-specific dashboards, location-specific dashboards, and index dashboards. Let's take a look at another example. Here we'll look at the social determinants of health dashboard. Indicators related to income, education, housing, public safety, and transportation will be presented. You can change the location, view, could be card or list, or the colorblind mode. Now let's have some fun and build your own dashboard. By first accessing the Explore Data tab on the main page. Next, you'll filter by location, topic, populations, classifications, comparisons, display subgroups, and sources. No fields are required. You are able to customize the information that you are looking for. Okay, let's try a live example of searching for an indicator using the search bar. So first, you'll go to the main page and you'll navigate to the search sidebar. Once you're here, you'll type in what you're interested in. In this case, I'm interested in learning more about school meals. The first thing that populates will usually be a series of indicators. In this case, I have one indicator that is relevant to what I'm looking for. That indicator is students eligible for the free lunch program. Here, I'm able to see a comparison for different periods, the rate, the overall percentage, how the indicator is doing, and I can see charts of changes over time, comparing the Washtenaw County value to the Michigan State value and the US value. Then if you keep scrolling, you see other relevant information. Let's take a look at our community health dashboards. Here you will find all the indicators we have available on the website and our pre-built dashboards already. So we'll scroll through and see all the different options ranging from access to care to disparities, all the way down to our Healthy People 2030 progress tracker. Then just a quick overview of the indicators that we have. You can see them through the drop-down menu here, or you can search by location. This includes zip code, census tract if it's available, civil division, county, or you can simply just look for cities. From here, you can select the indicator that you're interested in, select a location type to continue, or you can search it up. For this example, we'll look at zip code for adults with cancer or melanoma. Then it'll populate the entire cancer dashboard indicator. And then we can take a look at the location map. We can press play if we would like to see a timeline, or we can just browse through and learn more about the indicator. Lastly, let's take a look at how we can build our own custom dashboard. Today, we'll start by typing in the indicator we're possibly interested in learning about, and I want to learn more about children with health insurance. So I'll go ahead and either type it in or scroll down and find what I'm interested in. Click on that indicator. Then I'll filter by locations. I'm interested in learning more about Washtenaw County values compared to Ypsilanti as a whole. Then I want to see our CHIP target, Michigan state value, compared to the US value. I want to narrow my search down to just specific subgroups. In this case, I'm more interested in learning about the race and ethnicity comparison. Then you go ahead and press search and you scroll down and you have your custom dashboard. So if you want to engage more with the indicator, you can click by county, or you can just look at your custom dashboard right here below. And that's it. It's your turn now. Pick a topic of interest to you or your work and see what information you can locate on that topic. Try building a dashboard related to the area of your interest. And thanks for joining. I hope this was helpful.